Hey everyone, my name is Kara Beardsell and this is my introduction video for Social Work 502. I'm just going to go through and answer the couple of questions that we were asked to answer for the intro video. So, the first question, describe your work role where you have encountered people who were diagnosed with a mental health condition. I have worked in 3 different settings since I graduated with my BSW in 2005, and I worked for actually a mental health provider, kind of, for 5 years doing supports coordination, which is also a way to say case management. And when I was at that particular agency, I worked with people with intellectual disabilities, a lot of whom who had dual diagnosis and also had some form of a mental health condition. So I worked with one woman who had schizophrenia. I worked with another woman who had borderline personality disorder. I worked with different people who had different levels of anxiety. And then in my second job, I worked same population, people with intellectual disabilities, but on the other side of that, and just in a different capacity, kind of still case management, but a different type. I worked, again, with people with intellectual disabilities, several of whom had a DSM-5 diagnosis. It was primarily anxiety, though we did have one guy that I worked with who had Prader-Willi syndrome, which I believe is a DSM-5 diagnosis. And he just ate constantly. It was not anything that he could control, so that was kind of serious. We had other people diagnosed with other various forms of mental health conditions in that capacity as well. My third place of employment, which I was only there for a year, it just wasn't something that I really enjoyed, so I moved on. But it was a school for children with autism, adults and children, and there were also, I believe, some children there who had additional mental health diagnoses. And then lastly, where I currently work and where I've been for the past 4.5 years, is a private foster care agency in Pennsylvania, and I work with children from birth through 21 who are currently in foster care, and it is shocking and sad the number of children who have a DSM-5 diagnosis and a mental health condition. I would say most of our females could be diagnosed with PTSD. Many of them have been diagnosed with PTSD. All of our kids, I would say, have been through some form of trauma. I mean, just being taken from your nuclear family and placed with strangers is traumatic in and of itself. But, you know, some of these kids tell some pretty horrendous stories of abusive situations that have led to a diagnosis of PTSD and trauma in some form. We've had children come from other countries, Haiti being one of them, and that particular child went through some pretty awful things in her childhood, so she had PTSD and trauma-related issues. I work with the kids' biological parents, and they also really are plagued by a lot of mental health conditions, and in some instances, it's actually those mental health conditions that prevent them from parenting their own child. So it's something that I would say that I encounter in my everyday life, and we see diagnoses in my current job, anything from PTSD and trauma to ADHD to oppositional defiant disorder to depression, anxiety, things like that. My agency also worked with juveniles who are in the juvenile justice system, many of whom are sex offenders. So they, some of them also have a mental health diagnosis as well. And some of the other kids that have a history in the juvenile justice system and are not sex offenders also have come with some pretty heavy, significant mental health diagnoses as well. So again, every day it's something that I see and that I run across, and that is just part of my everyday job. So in what ways do I participate in a treatment team to make a DSM-5 diagnosis? Well, interestingly enough, the agency I work for actually, the way that we work with our population of kids is that we have treatment teams. And those treatment teams consist of a case manager, a clinician, so a therapist, and we also consider the foster parents part of that treatment team because really they live with these kids and they know those kids in and out better than I do. And then they all have a children and youth services caseworker, and that person is also considered part of their treatment team. So it's a I work in collaboration with other people every day around kids and what they need and how to serve them. The treatment team itself does not make any DSM-5 diagnoses. None of us have a doctorate or I would say the credentials to be able to do that. But we do collectively look at symptoms and behaviors that kids might be exhibiting, to then make a determination of like, do we need to call and get another appointment with a psychiatrist? Is this something new? Do we need to get them an assessment? And with an intake place, someplace, whatever that might look like. So I would say as far as the treatment team goes, the role that we have in, making diagnoses, which we don't really do that, but we are kind of like the first leg of the process. And if we are not the ones to start the process, like maybe a kid came in to the agency and was already on medication, it would be my job to secure a new psychiatrist if we get kids from all over the state of Pennsylvania. So the kid might be from like Pittsburgh and they're coming to our agency on the eastern side of the state, and obviously going out to the psychiatrist every week is not going to work, or every month or however often, so we have to find a new one. And then, we go through that whole process. And I will say as a side note, it's a really daunting process trying to navigate the mental health system and the insurance and all the other policies that go along with just trying to simply get a kid mental health care. It's really kind of daunting and frustrating a lot. So, but anyway, so that's kind of my role, like, on the treatment team, is really just to determine, are we seeing things? Does this kid need to see a psychiatrist? Do we need to get them in someplace? So that's my role there. And then in what ways do you participate with the practitioner to make a DSM-5 diagnosis? A lot of times, I would say 85% of the time, I'm the one taking the child to the psychiatrist. So, I would take them for the intake, I would take them for the evaluation, I would do all those things. So I'm pretty much the adult in their lives who is giving the psychiatrist relevant information about a child who is needing services. So I go in, I meet with the doctor, I let him know what we're seeing, why we're here, what behaviors we're encountering. Children over 14, I don't know if this is a state law or a federal law, but in Pennsylvania, they can consent to their own medication management, and their own treatment plans and their own medication. So sometimes I would say I've never encountered a psychiatrist who didn't at least want to meet with me first. Like, none of them, I've never encountered one who just met with the kid and kind of taken what the kid has said. They always meet with me, and they can't always give me a lot of information, but they can certainly listen to the symptoms that I'm expressing that we are seeing. And so I don't necessarily work with a psychiatrist to like create the diagnosis or come up with the diagnosis. That's the psychiatrist's role, because they have the credentials to do that. I do not. But I certainly go in and participate in evaluations by giving the symptoms that I'm seeing, both in the school setting and the home setting, symptoms that are reported to me by others. So it's a big responsibility. And then I work with the psychiatrist. They develop a treatment plan, and I don't necessarily work to develop it, but again, the information that I'm providing them certainly like goes into parts of the treatment plan. So I would say, in summary, I don't have a lot of experience with actually giving a diagnosis. Although sometimes, there'll be like the classic symptoms of something that we've just seen so many times in foster kids that have come in. So, I'm able to kind of like guess, but again, I don't do the actual diagnosing. It is something that I see every single day. I cannot think of any time. My caseload is changing, not too frequently, but frequently enough. Like, I would say every couple of months. I don't think I've ever had a caseload where like at least a third or a quarter of the kids haven't been have been diagnosed with something. So it's I don't know if it's the majority, but it's a good number of children that I've worked with and still see, every day that have some form of a diagnosis. So, that's a little bit about me, what I do, what I've experienced as far as the DSM and making diagnoses and my experience with clients with mental health conditions. So I look forward to meeting the rest of you and watching your videos and learning of your experience too. Thanks.